Okay, Janine. Uh,
Yes.
Kailangan natin malaman anong nangyayaring in terms of humanitarian help sa Ukraine. Anong mga
Totoo.
efforts. And then,
Totoo.
gusto ko rin tanungin kasi gusto ko rin malaman kung if I'm a Filipino living in Ukraine, what should I do
Right,
at the
right.
moment? Okay?
So, Tito Brett, may kilala ka ba na pwede natin tanungin ng mga questions na ito?
Actually, meron, she's a public doctor. She has experience in humanitarian work. So, tawagan natin si Tita Jade. Okay?
Wow, a Pinay to be proud of. I'm excited to meet Jade.
Okay.
Hello! Welcome
Hello.
to Kwentuhang Pinoy.
Salamat,
Jade.
salamat. Hello din. Hello.
Bonjour, bonjour.
Bonjour. You're in France now, right?
Yeah, but I've lived for some years in different parts of Europe. So, hola! Guten
Hola,
Tag!
okay. I'm in Spain kasi. I'm in Spain. But how long have you been living na in Europe? Matagal na.
20 plus years. In and out in Germany. So, nagsimula sa Cologne, then Berlin. Then I did my master's in Holland. Then I live after in Holland, and then back to Berlin. And then ended up for a few months in France, ended up a few months in Barcelona, and then a couple of years back in Paris, 2 years in Berlin, and now back in Paris.
So it's like you had a sampler of Europe already, no? You know the context of everything. So great to have you here. Thank you for joining us in Kwentuhang Pinoy. Apart from like living in Europe and being a Pinoy living in Europe, you also work in development. So how long, like the entire time you were working in development?
Well, it's not just a small correction. It's not exactly development. It's more of humanitarian work. So I've been in different places, in different stages of humanitarian needs. So merong stable context, merong acute context, emergency context. So that really depends. Cholera outbreaks, conflict, war zones, stable conflict, merong ganon, stable conflict.
So you have experience in all of those, no? Like, okay.
Jade,
Yeah.
So in terms of how do you classify the conflict in Ukraine? Is it stable?
But that's now really an emergency because there's an ongoing conflict, you know. Ang ano dyan, people will be displaced, and we can see that already. People are fleeing, crossing borders. This is reminiscent of the Bosnian War when I was in Germany. Bagong dating pa lang ako sa Germany noon. Talagang yung televised war talaga na every day nakikita mo yung bombardment sa television, and a feeling mo talaga noon yung markets binobomba sa Bosnia noon. Feeling mo I have to do something. But kadarating ko pa lang ng Germany, no? So I couldn't. I was only able to do this kind of work 3 years after. Para nag-stabilize muna yung aking status, yung resident status ko sa Germany before I could do that. Yeah.
So when you talk about humanitarian services, saan sila magsiset ng mga parang base camp, or saan sila magpo-provide doon mismo sa war zone, or
no, it's very rare that you are really on the front lines. No. So what happens is in the more stable, quote unquote, na pinakamalapit dun sa front line, no? So syempre titignan muna ano yung needs. Ang urgent talaga ngayon yung protection, kasi protection ng women, children, elderly, disabled, people with disability. Yun ang priority in terms of protection, no? Tapos usually ang mandate, ang may mandate niya UNHCR. So sila yung talagang may mandate niya. Now the other non-governmental organizations like ICRC or MSF or marami pang iba, acute AMI. Basta maraming organizations who are in this humanitarian work, no? Depende rin ano yung mandate nila, no? Kung health, so titignan din, hopefully hindi affected yung hospitals, kung standing pa yung hospitals, so what are the needs? Kailangan ba ng support sa staff? Kailangan bang i-complement yung staffing needs para ma-provide yung services, supplies, especially medical supplies, kasi pagka ganyang conflict, disrupted lahat ng supply lines mo, food and medicines and medical equipment, no? So yun ang titignan. Tapos ang importante din diyan yung continuation ng treatment. For example, yung mga taong may hypertension, may diabetes, kailangan tuloy-tuloy pa rin yung treatment nila, no? Tapos dun sa mga acute services, kasi may mga bata, yung pediatrics, it's still winter. So yun, maraming aspects ng needs, humanitarian needs in this kind of situation. Yung heating, for example, disrupted din ang heating pagka ganyan, kasi depende ano yung na-damage ng bombings. Yeah.
Question, Jade. Question.
Yeah.
You've been in the Bosnian War.
No, I'm not been in Bosnian War, but
you've seen the Bosnian War, the civil war.
yeah.
And then now you're seeing this Ukrainian conflict. What do you think? Ano mas grabe? Ito ba mas grabe ngayon? Because with all the new technologies in warfare, or what do you think? In your opinion?
Di mo pwedeng i-compare yan, kasi in the end, ang impact niyan sa akin across countries, mental health. Yung trauma ng population. Yeah, it's beyond physical wounds, kundi yung psychological trauma.
Parang losing your home, no? Being displaced, losing your home, and then what happens?
Hindi, tsaka hindi ka makapagplano. What are you going to do the next day? So even as a refugee, those who came to Germany as refugees from Bosnia, they also couldn't plan what's next. How long am I going to stay here? What if I'm sent back there and the country is not yet rehabilitated? How am I going to feed my family? You know? Yung limited yung stay ng Bosnian refugees at that time. So after nag-stabilize yung Bosnian Croatian War at that time, they started sending back the refugees na siyempre hindi pa handa yung i-absorb lahat yun, you know? Yeah.
But I mean, this has happened in various parts of the world, no? Na parang may conflict, and then there has to be like displacement and all that. What have we learned from past conflicts that's going to be applied now to?
But, yung Bosnian War, tumagal yan ng ilang years. Yung Kosovo, maigsi lang yung Kosovo War. It really depends on the political will of the governments around this region. And in Kosovo, maigsi lang yun, for hindi ko na matandaan bakit, but that was in 1999 when that happened. I was somewhere in Southeast Asia. The middle of nowhere that time.
But may conflict rin sa Southeast Asia at that time nung nandun ka.
No, it was a quiet project, but I was still getting news 3 months later.
Eto, tanong ko, Jade, the danger for humanitarian workers. Is it dangerous?
There's always danger. I remember one communication noon sa opisina namin. So they're calling for volunteers for a certain country. And somebody asked, what is the risk? It would be interesting to read about the risk. Ang sagot nung pinaka-head nung organization, one sentence lang. The risk is the war. Ang tawa ko talaga, you don't need 20-page document. You don't need a 20-page document to tell you like
Gets
the
na.
risk is the war.
Gets it. But it's good to know that there's a process to it, right? Like, I mean, coming from outside that world, it's good to know na, okay, like first they determine what's the closest area na medyo secure pa. And that's where they send help, and that's where they try to get, the people to go to get like the basic services and all of that. May assessment and diagnosis na yung kailangan, and then that is what's sent. So
And then you
ang ganda
prioritize. You prioritize
Correct,
because
correct.
we cannot do everything. You prioritize.
Right. Right. But then, parang the next question is, okay, this is happening now, and it's like this exciting news story, and everyone's looking at it. But then, also, this has happened before, and we forget it, no? But the people that live through it, parang they have that trauma still in them, and parang the effects last for years. So, for example, in the Bosnian War, do you still see? I mean, I'm sure you're in contact with some people that were.
I never worked in Bosnia. It's just one of the cases that significant. Kasi it's one of the first European-based war in the post Soviet Union world, Yeah.
But are there like ongoing efforts for conflicts na parang in our mind tapos na?
After the war, I mean, there continued to be psychosocial programs to address yung psychological traumas. And pero that's just one part. Kasi it's not just in Ukraine now. It's also happening in many places. Ethiopia right now, in Tigray, in South Sudan, in Syria. Ang hindi lang health ang pangangailangan diyan, kundi yung pagkain. Kasi people are not working, people are not able to buy food, So yung psychological services is just one part, but you still need the basic needs.
Basic needs.
Water,
like food,
hygiene,
water, emergency services.
Yes.
Okay, question. If I'm a Filipino now in Ukraine, what should I do?
What I heard, there are about 300 Filipinos in Ukraine, no? Yun ang nabasa ko noon. And depende yan kung lilika sila o hindi. They should get in touch with the embassy. I'm sure the embassy or consulate is looking after them. Pero depende pa rin sa kanila kung gusto nilang lumikas o hindi. Kasi my experience in Libya, no, nung time na paalis na si Gaddafi and there was ongoing conflict at that time. May mga Pilipino rin doon. Merong umalis, pero meron ding naiwan pa rin talaga. Depende rin siguro sa kanila yan kung ano yung perception nila ng danger or not, no? So yung mga nasa malapit sa front lines, bumalik sila sa Pilipinas. Yung medyo malayo-layo pa sa front lines, sa active fighting, nandun pa rin sila doon sa cities, no? And they were even offering me adobo.
Doon ha? Sa Libya?
Uy, first episode namin yan ni Tito Brett sa
Sa
Kwento
Libya,
Pang Pinoy, adobo.
Sabi ko naman, hindi ako oo, kasi naawa naman ako doon sa mga kasama ko na subsisting on kebabs, Tapos meron din kaming curfew, so hindi din ako makakapunta sa bahay-bahay nila. So, maawa naman ako na masarap ang pagkain ko, tapos yung mga kasama ko, kebabs.
Did you suggest to them na, ba't di pa kayo magpa-repatriate?
Sayang yung pera.
Talaga? For them, yun pa rin yung priority.
Yun ang priority. Ayun, kumbaga, that keeps them working.
Yeah.
And I guess yung parang they don't see it, they're not there where the fighting is happening. So parang, malayo yan. Diba? Parang for them malayo.
Midwife yung kausap ko, Midwife. Sa hospital. Yeah. At sabi pa nga niya, sayang kasi may mga padating na midwife na naantala. Yeah.
Okay. Like, I think maybe last question, but being Pinoys living in Europe, like, for me, like I'm in Spain, it's a little far. The people here aren't necessarily like talking about it much. Alam mo yun? Parang life is normal pa rin. So, like, I care for some reason, but there are people na hindi. So, like, why should we care about this issue? And being civilians, what can we do to help?
Because at some point, all of us have experienced war. Our countries have experienced war, and in the Philippines, we experienced war during World War II, and people helped. There were people who helped the country. Hindi lang natin alam kasi hindi pa uso nun masyado yung humanitarian help, but there were private people who might have been helping. We are all part of this global community. We need to, hindi pwedeng Ukrainian siya, malayo siya. No, kasi we're all in this world together.
Right. Today it's Ukraine. Tomorrow it can be something nearer. It can be, I don't know. If this continues, I don't know, might be tomorrow there will be another power who thinks they can invade another country. It's really also looking at the right to self-determination. And this comes close to the Philippine issue also, because when it comes to the right to self-determination, what about West Philippine Sea? What about indigenous peoples who are also have the right to self-determination and shouldn't be deprived of their ancestral lands, for example? So we're all in this. It's hindi pwedeng sila lang yan. Hindi And for those who want to help, there are many organizations who you can give as low as €1, and €1, it accumulates, and then it becomes significant enough to help other people.
Okay. That's my last question for you, Jade.
Yeah.
How can I help? Ano mga organizations in Europe? Saan ako pwedeng mag-donate?
Well, there's Red Cross. You have your local Red Cross there. The Spanish Red Cross, the German Red Cross, that's one. There's the Doctors Without Borders, Médicos Sin Fronteras. There's Save the Children, because it's not, as I said, it's not only health, but also Save the Children is also doing some emergency thing. Oxfam is also, especially magaling sila sa tubig, sa water provision. WFP, World Food Program, kasi sila yung nagpo-provide ng pagkain. So, yun.
But, pera ang ibibigay ko or?
Mas maganda kasing pera That's the easiest And UNHCR, before I forget, UNHCR, because they also provide protection, which is also needed. Yeah. And that's the easiest. And it doesn't have to be a big amount, 1 euro, 2 euros, 5 euros. It's yung pangkape ninyo, i-donate nyo na lang. Ganon.
Oh.
Yeah. I'm getting
Okay.
chills, Thank you so much, Jay. Parang I'm getting chills because, I don't know, it became closer because I see the Oxfam here, you know what I mean? It's like, I can do something to help. Na, I don't know, iba rin pag online and then you donate online, ewan ko, walang connection versus going there, asking them, what you need, can I donate here? Parang, ang ganda. Hala, naiyak na ako. Thank you.
Thank you very much, Jade.
Anytime.
much.
Yeah.
Thank you
And
very much,
ingat,
Jade.
ingat,
Stay safe.
ingat.
Ingat ka kasi hindi natin alam kung
Stay
saan
safe.
kayo papadala.
Keep warm.
Or adrenaline junkie.
Okay.
Pinay to be proud of. Thank you so much, Jade.
Thank you.
Thank you very much. Bye-bye.
Bye-bye.
Bye.